Hi people, my name is Dr. Tungani and in this video we talk about cancer of the uterine cervix. This is part 1 of the topic, that is the introduction, and there is a part 2 video where we talk about diagnosis and treatment of the disease. To start off, it's good to remind ourselves what cancer is. And simply put, cancer is a disease caused by uncontrolled division of abnormal cells. Secondly, note that cancer is referred to by the name of the organ where it began, even if it spreads to other areas. Okay, let's talk about the uterine cervix, also referred to as the neck of the womb, as it connects the uterus to the vagina. Important to this discussion is that the cells covering the surface of the cervix undergo constant changes in a woman's lifetime in response to things like hormones, the vaginal environment, and infections. Now, most of these changes are temporary and harmless. However, some may be long-term with undesired effects. Much about the normal. Now enter the villain, human papilloma virus, HPV. This is a sexually transmitted virus of the reproductive tract that is associated with the majority of the cases of cervical cancer. Now, how does it cause cancer of the cervix? Simply by getting introduced into the female reproductive tract. It infects the cells covering the uterine cervix and causes internal changes in them. These changes are not cancer in themselves, and in fact, in healthy individuals, the body immune system can fight them off. However, in people with low immunity or after repeated infections, the changes can persist over months to years and eventually lead to cancer. Please note again here that the initial changes are not cancer yet. It takes months to years to get from the infection to cancer, and the changes can easily be picked through screening tests. Now, like with most diseases, some people have a higher risk of getting cervical cancer than others. For example, people with multiple sexual partners, or people who had early sexual debut, or people who have been treated for other sexually transmitted infections are more likely to come into contact with the virus. Also, as with many other cancers, cigarette smoking increases the risk. And to add that people with low immunity, like can occur in HIV infection, have higher risks of getting cervical cancer. So we've said that HPV infects cells on the surface of the cervix, and that most people, the immune system fights off the virus, but in a small percentage of people, the virus persists and causes changes to the cells and abnormal growth over many months to years. Now, once the abnormal growth starts, it can manifest in various ways. It can manifest as a wound, it can manifest as a mass or a growth, or it can spread to other areas. Initially, as the changes occur, the woman may have no symptoms at all. But as the growth persists, she can start having bleeding between periods, bleeding after intercourse, or even bleeding when she had already reached menopause. There can also be an unusual discharge. There could be pelvic pain, or in advanced cases, she may notice difficulties in passing urine or stool, or blood in urine or in stool. Wow, now let's take a breather. Clearly, this is not a good disease to have, and any way to avoid the virus should be welcome. The good news is that there is a vaccine against the virus. It is effective in girls who have not been exposed to HPV, so it's important that it's administered early in a person's life. In Kenya, girls aged 10 years are encouraged to get it. To end this section, we can say that cancer of the cervix is a horrible disease. It's mostly caused by a sexually transmitted virus, and there is a vaccine against this virus. In the next section, we'll talk about screening, diagnosis, and treatment of cervical cancer.